Hi everyone, TinaPhysio here. Today I thought I would talk about Dupuytrens. Hi everyone, TinaPhysio here. So today I thought I would talk about Dupuytrens. So Dupuytrens is also known as Dupuytren's contracture, or you might have heard of it called Viking's disease. What exactly is it? So Dupuytren is the name of the person, the physician that named it after himself. Besides being a really tough name to spell, beyond that there's not too much else to it that you need to know. But the contracture, or the disease part, what it's actually referring to is when the collagen tissue in your palm starts to grow excessively, that you actually will start to get little nodules forming in the region. The most common place that you'll see it is in the base of the fourth finger, is usually where it starts. So Dupuytren's often will actually kind of break it down into 3 stages. Stage 1 is when you start to get that first bit of excess collagen forming. So you might feel it as like a lump or a bump or a palpable nodule. Sometimes it might be tender, but generally it's pretty pain-free. You just tend to notice that it's there. And again, usually at the base of the fourth finger. As that collagen production progresses along, you might start to get a larger lump or even an actual cord formation in this area. As that collagen tissue grows more and more in that region and it's attaching in that area, you might even start to notice that that finger is starting to bend. So it can't fully straighten, or when you pull on it, you'll feel or see some puckering in the palm of that hand. So that's usually around kind of a late stage 1 or early stage 2. As that collagen continues, what will happen then next is that finger will start to bend more and more, and sometimes it might even start to pull another finger along, okay? So in folks like this, in a stage 2, now we're having difficulty straightening those fingers. In a stage 3, that actual contracture becomes severe enough that those fingers might be bent right down, and functionally this person might have difficulty putting on gloves, reaching into their coat pocket, or grabbing, holding, carrying things. So it really starts to affect their function in the day-to-day. So now that you have an idea of what Dupuytren's contracture is, the next question is, what can we do about it, if anything? So currently right now, because it is a relatively pain-free type of condition, the way our healthcare model works, I'm not saying is right or wrong, but generally speaking, if it's not causing any sort of pain, and in the early stages with just a nodule or an early cord, if it's not affecting your function, we usually don't do too much for it. Now, there's nothing out there saying that if you have stage 1 or you first start to get a nodule in this area, that it will for sure progress to a stage 2 or 3. Sometimes people might have a nodule there, and that's all it is for the remainder of their life. And that's okay. Now, if, however, it does start to progress along and it starts to affect your function, where you're having difficulty holding things, gripping things, then we might actually do something about it. So there are a couple of different options out there. Some aren't fully validated with research. You might hear about them. So anecdotally, you might, a friend of a friend has had some benefit with it. I won't speak too much on those, but basically medically what we're looking at is we just don't have a lot of research for some non-conservative methods right now. So there's nothing to say that right now, there's no long-term research studies that say if you massage it after 20 years, you'll prevent it from progressing to stage 3. But however, keep in mind, massage is pretty safe and gentle. We're not at risk for anything. So if you want to massage it and you want to do some stretching on it, there's also no research or anything saying that it's harmful to it either. So just because the research doesn't say that it will for sure prevent it from getting worse at this point, I think it's pretty safe to try it out just in case it does work, okay? Just because the research doesn't show it, it might still be effective and beneficial. All right, so moving on. So let's say, for example, that now the contracture or that collagen tissue has grown significantly enough that now your finger is bending. It is now affecting your function. So going back to you can't put a glove on, having difficulty carrying things or holding things, and it's starting to actually affect your life and your day-to-day activities. So there are two main, generally speaking, options that they start with first. So when you go to see your surgeon or your plastic surgeon, one of the treatment techniques that they might look at doing is called a needle eponeurotomy. So what that is essentially you're awake for the procedure, so they'll freeze the area in your hand. The doc is going to mark out along the line of where all that collagen is. So they'll just use a pen, make markings on where they're going to go in. Once your hand is frozen, on those little dots where they made the marks with the pen, they'll take a needle and insert it and essentially break up that excess scar tissue that's in that area, that collagen tissue. So as they're breaking it up, they're pulling and moving your finger, and they free up that motion right away. So this procedure might be a 30-minute procedure done in their office. And again, you're awake for it, so it's done under local, and you can actually see your finger moving and bending by the end of it. After that procedure, you might see your hand therapist. The doctor might want us to make a splint for you to wear at nighttime, for example, to make sure that over the next few months it doesn't come back right away. Now, it is still possible after having this procedure done that the Dupuytrens can return, okay? The success rate is pretty good, so usually half or more. However, there's nothing guaranteeing that it won't return. Another option that is available, so in some areas, so it's a little harder in Canada now, but in some areas you can still get a treatment where they inject an enzyme. So this enzyme is called a collagenase, but it goes by different brand names as well. What happens here is collagenase, so it's an enzyme that breaks down collagen. So when you go to see your plastic surgeon, what they'll do is they'll actually inject that enzyme into this region of your hand. So then over the course of the week, that enzyme's naturally just breaking down that excess collagen. You'll go back to your doctor's office about a week later, and then what they'll do is they'll then stretch your finger to actually break apart those last few cords of the collagen that are holding together. So you get the injection, come back a week later, they stretch and break those extra tissue bands, and then you'll have that motion, and restored and that ability back. Now, of course, depending on how severe that contracture was to begin with and how long you've had it, that can affect how full the motion returns as well. In some more severe cases or more advanced cases of Dupuytren's, sometimes they'll still opt for a solution where they go in for surgery. So they might make an incision through this area, actually go in there and clean out that excess collagen tissue. And that's still a procedure that can be most effective in some cases. Obviously, discussing with your plastic surgeon would be the best option to figure out for you what's the best case there. After that type of surgery, again, some cases you might see your hand therapist to make a splint and might do some other exercises for some scar management in that area. Now with Dupuytren's, there do come some extreme cases. So in some cases you might have it, you might hear about folks getting it on both hands. There are very severe versions of this where it's a diastasis. It's also able to affect other body parts. So this type of collagen production can actually show up in the bottoms of the feet, and in men it can show up in the penis as well. So it's an interesting condition, lots to learn about, but generally speaking, no panic, it's not painful, and until it really affects your function, we kind of just monitor it. So if you have any questions, feel free to ask, drop me a line below, and then I guess otherwise until next time, bye!